There may be times where, as part of your personal protective equipment, you'll be required to wear a respiratory mask or an N95 or FFP2 mask. This includes when undertaking procedures such as intubation, extubation, mechanical or manual ventilation, suctioning and chest physio. The reason is these procedures all create aerosolized particles, and these masks will afford you more protection in those circumstances. In order to put on the respiratory mask, you don your PPE in the same fashion as you would, but replace the surgical face mask with one of these masks. In order to fit it correctly, you need to bend the nose piece to allow the straps to fall out. Then, holding onto the straps, you place the chin against the chin piece and bring them up and over your head. You can see at this point I don't have an adequate seal, particularly around my nose. In order to make sure the seal is effective, you need to mould the metal bit against your face and ensure you have a good fit under your chin. You can manipulate this by adjusting the straps. Once you've fitted your mask, it's really important to make sure that you have an effective fit by checking with a buddy. When you breathe in, the mask should collapse against your face and then return to a normal shape when you exhale. If you do not have an adequate seal, the best course of action is to remove the mask and attempt to refit it. Once you've finished your patient contact, you doff your PPE in the same fashion that you would normally, except when it comes to removing your mask outside the patient's room or outside the red zone, you'll do so in the following way. Holding on to the bands across the head, you can lift them gently up and away from your face, and then leaning forward, allow the mask to fall away from your face, immediately disposing of it in the healthcare waste.